I'm an interventional cardiologist, and actually I've been practicing medicine now for about 20 years. Trained at Tulane, New Orleans, did my internal medicine, cardiology, and cardiology fellowship there. Moved to Huntsville about 18 years ago, and ever since I've been in private practice here. You know, one of the things I noticed over the last 5 to 6 years, that more of my patients that were sent to me for consultation were having symptoms and complaints that were related to adverse drug reactions. And I stopped to think, why was this happening? Why am I seeing more of this occurring now? And then I began to realize, since I graduated from medical school, really the practice of medicine has changed. The primary care doc is no longer the quarterback. The average patient that I see will see 4 or 5 different practitioners. You may see a cardiologist, a family practitioner, a nephrologist, a rheumatologist, where they all are writing medicines, but no one was really paying attention any longer. And that's what really started, I guess, baited my interest in taking a deeper look into polypharmacy. You know, initially, I really felt, up until I got involved in personalized medicine, that I was a very good physician. But the more I started to investigate the value of medication reconciliation and stop and taking a look, I was really passing some very simple drug interactions that was resulting in a significant amount of, I guess, discomfort, or causing a lot of symptoms in my patients that I didn't recognize. Simple over-the-counter medications such as Benadryl, you know, can really result in significant side effects for your patients. But these were little things just simply from the lack of education, the lack of knowing, the lack of realizing that it could have that type of impact. Most of us, particularly subspecialists, but we all are guilty to some extent, we're only interested in the medications that we prescribe to the patients. But you really have to take a look at all of them, the whole big picture. As I got more involved, as I saw more patients with complaints, my whole approach to the patient and managing that patient changed. We were all taught, again in medical school, that when a patient presented to the office with a complaint, we wanted to start that patient on a medication. And that's the way 99% of physicians practice medicine. But now when I see a patient, as far as I'm concerned, one of those medications are guilty or responsible for the patient's tachycardia, dizziness, lightheadedness, passing out, change in mentation. So instead of starting the medicine, I start stopping medicines. I cannot tell you how many patients that have presented for many months with disabilities, and it was a result of a drug-drug interaction. You stop 4 or 5 of the medication, the patient improves, and most importantly, a lot of our patients on fixed incomes. It makes a huge, or has a huge impact on their overall financial well-being. So it's really, it's a win-win in so many different ways. You know, I can think of so many. Let me give you a patient that I saw just last week. I had a patient who had irritable bowel syndrome, and irritable bowel syndrome can be very difficult to treat. Usually these patients will have diarrhea rather than constipation, and a lot of it, I'm not sure exactly what causes it. It can be due to emotional stress. But this patient was on, basically was referred to me because of unexplained tachycardia. The patient had several episodes of atrial fibrillation, atrial flutter, and it was really disabling for this patient. I took a look at her medicines, and she was actually on 3 very potent anticholinergics. She was on Bentyl, she was on Robenal, several other medicines to kind of control her symptoms. But it was actually the medications that had been prescribed to control her symptoms was actually causing her problems. After discontinuing 2 those very potent anticholinergics, the Bentyl and the Robenal, her tachycardia, which she had spent thousands of dollars trying to get this evaluated, completely resolved. If you look at the average patient over the age of 60 is on 5 or more medications. Everyone really. If you don't have a physician who's involved in intense medication management, you should ask him to review your drugs when he comes in to make sure that you're on an appropriate medication, or send you somewhere where you can have medication reconciliation performed. Because it's really, really important. It's an important part of your health care is to make sure that you're on appropriate medication and that someone is paying attention.